Alberta Health Services. Healthy Albertans, healthy communities, together.
And good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. This is a meeting of the Board to consider 6 motions. To start, in the spirit of recognizing the harms of the past, promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historic and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories in which they live and work as well. We are grateful to those who have come before us and mindful of those who follow us as we steward and protect these lands. You will all be aware of the new temporary public health measures announced by the government on Wednesday night. The board welcomes these measures, and we hope these measures prove effective in slowing the spread of COVID-19 virus throughout the province and easing the pressure on our hospitals. These pressures are intense and unprecedented, and our President and CEO, Dr. Verna Yu, would like to share an update on health system capacity with you in a few minutes. But before I invite Verna to speak, I'd like to talk about the small but angry protests we've recently seen outside of a handful of our healthcare facilities. Let me be clear, I believe in the right to peaceful protest, that it is a cornerstone of our democracy, and this board supports the right for people to voice their opinion and dissent. However, I was disheartened and in some cases very distressed by the nature of the protests we've seen this week at some of our hospitals. There were instances of AHS employees being harassed and yelled at. And it's not just our staff and physicians, as if that weren't bad enough. Some patients and families who are already going through a stressful time in their lives had to deal with being obstructed as they tried to get access care in some of our facilities. That is inexcusable behavior. It's absolutely not appropriate to take out your frustrations and anger on healthcare workers who continue to do all they can to care for Albertans under extremely stressful circumstances. They do not deserve to be targeted and harassed. They deserve our respect, our gratitude, and our support for everything they've done the past 18 months of this terrible pandemic. This board stands with healthcare workers, patients, and their families, as I suspect the vast majority of Albertans do as well. We also support AHS to take all appropriate measures to ensure staff, physicians, patients, and family are protected at our healthcare facilities from overzealous and aggressive protesters. And now I would like to invite Verna to add her opening remarks. Verna?
Great, thanks very much and good afternoon to everyone. And thank you, David, for your comments on the recent protests. Further to what you mentioned, I'd like to extend my gratitude to our protection services teams around the province. In recent days, they've really stepped up into heated situations outside some of our hospitals and worked to protect the safety of patients, physicians, staff, families, and even the protesters themselves. These demonstrations have been really unnerving for our staff. Our protection services teams have done a phenomenal job in de-escalating these situations, keeping people safe, and for that, I just want to publicly thank them for their efforts. Now, I'd like to provide an update on hospital capacity. Our provincial healthcare system continues to experience severe capacity challenges greater than we have faced throughout this long and exhausting pandemic. We currently have 322 ICU beds open in Alberta, including 149 additional surge spaces. AHS has opened 49 additional ICU surge spaces in the past 7 days. There are currently 260 patients in ICU, the vast majority of whom are COVID positive. Provincially, ICU capacity, including surge beds, is at 81%. Without the additional surge spaces, provincial ICU capacity would be 150%. The number of patients in ICU has increased by 13% in the past 7 days. Because of this increasing pressure, we're taking 2 extremely difficult steps of reaching out to other provinces to see if they have available critical care space and or available staff, and also asking if they have some skilled staff to come with us to assist us in Alberta. We remain hopeful that it will not come to that as we continue to add critical care beds here in Alberta. In addition, we're taking further steps to educate our clinical team to our critical care triage protocol. To be clear, the protocol has not yet been implemented and would be an absolutely last resort. AHS will continue to do all that we can do to add capacity, and we will continue to do so until we have exhausted every single option. I would once again like to acknowledge our incredible physicians and healthcare professionals who somehow continue to go above and beyond every day. I'm grateful and thankful for everything you are doing. To any Albertan who has not yet been immunized and who may be hesitant, I urge you to consider. If you have questions or fears, please reach out to a healthcare provider, call 811 or visit the AHS website. If there is a barrier to you being immunized, such as travel, please call 811 and ask for help. Stay well and stay safe, and thank you. David, back to you.
Thank you, Verna. We are participating by telephone conference today. When I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I would take it that you are in favor of the motion. If there are none or a minority who either abstain or oppose, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
This is Sai Zelfi. I so move.
Thank you, Sai. Will someone second the motion?
Chair, it's Deborah Apps. I'll second that motion.
Thank you, Deborah. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I'll ask Brian, the chair of our Finance Committee, to present the Finance Committee report.
Thank you. The Finance Committee met on September 9th, 2021. The committee received updates on the status of RFPs and reviewed a multi-year forecast. The committee also discussed 2 recommendations for board approval. First, the committee reviewed the Q1 2021-22 investment report and recommended board approval. The board reviewed the report and the members support the approval. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below. A, as at June 30th, 2021, Alberta Health Services held restricted and unrestricted funds managed by Phillips, Hager and North Investment Management and Manulife Financial totaling $1,588 million. B, the funds were invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, real estate funds, Canadian and global equity funds, and C, all of the funds invested during the quarter ended June 30th, 2021 were invested in accordance with the investment bylaw and investments policy.
Thank you, Brian. Will someone second that motion?
Hartley Harris, I so second.
Thank you, Hartley. Is there any further discussion? Any opposed or abstentions? The motion is carried. Brian, you have a second motion.
Second, the committee reviewed amendments to the Brenda Strafford Foundation amended and restated Master Services Agreement and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls or Commitments. The board reviewed the recommendation and the members support the approval. Accordingly, I move that Alberta Health Services Board approve 1, the following amendments to the Brenda Strafford Foundation amended and restated Master Services Agreement. A, for services at the existing Tudor Manor in Okotoks. 1, to reduce the supportive living spaces by 63, resulting in a total of 89 supportive living spaces. And 2, to add 63 long-term care spaces, resulting in a total of 63 long-term care spaces. And B, for services moving from the closing Clifton Manor to the new Clifton House in Calgary. 1, to move the existing specialty long-term care spaces from Clifton Manor to the new Clifton House. 2, to move the existing adult day program from Clifton Manor to the new Clifton House. 3, to add long-term care services at the new Clifton House for a total of 103 long-term care spaces for a 5-year term. 4, to add supportive living services at the Clifton House for a total of 62 supportive living spaces for a 5-year term. And 5, to terminate 165 long-term care spaces at the old Clifton Manor on the terms and conditions reviewed by the Finance Committee and such non-substantive changes that management or Alberta Health Services considers necessary or advisable. And 2, delegate the authority to the Alberta Health Services President and CEO to execute the agreement to effect such amendments referred to above on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls or commitments policy.
Thank you, Brian. Will someone second that motion?
This is Heidi. I will second it.
Thank you, Heidi. Is there any further discussion? Are there any opposed or abstentions? The motion is carried. I will now ask Natalia, Vice Chair of the Audit and the Audit and Risk Committee, to present the Audit and Risk Committee report.
Mr. Chair. Sorry, Natalia. Mr. Chair, just a point of order. I think that we have an item that perhaps you'll move to the end, the approval of the minutes.
Thank you. I did recognize that. I appreciate the heads up. I will move it to the end, to be clear. So, Natalia, did you want to do the report?
Yes, thank you. The Audit and Risk Committee met on September 9th, 2021. The committee received a quarterly financial report, an update on standing and implemented audit recommendations, an overview of the enterprise risk management function, the quarterly enterprise risk management summary, and a legal and privacy update. There were no items that came through the committee for board approval.
Thank you, Natalia. I will now ask Vicki, Chair of the Community Engagement Committee, to present the Community Engagement Committee report.
Thank you, Chair. The Community Engagement Committee met on September 9th, 2021 to consider 2 recommendations for board approval relating to new appointments and term renewals of advisory council members and the appointments of trustees to established foundations. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare. As is our typical practice, given the number of appointments and renewals, the names of the members and trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly following this meeting. First, the new appointments and term renewals of members to advisory councils. The responsibility to appoint advisory council members lies with the AHS board. The committee recommended the board approve the member new appointments and term renewals as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the 11 new advisory council appointments effective October 1, 2021, and the 8 Health Advisory Council term renewals effective October 1, 2021, for the terms reviewed by the Community Engagement Committee and the Alberta Health Services Board.
Thank you, Vicki. Will someone second the motion?
Natalia Ryan, Chair. I'll second that motion.
Thank you, Natalia. Is there any further discussion? Any opposed or abstentions? The motion is carried. Vicki, you have a second motion?
Yes. Second, with respect to the appointments and reappointments of trustees to foundations. The responsibility to appoint trustees to established foundations lies with the AHS Board. The committee recommended the board approve the trustee appointments and reappointments as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and reappointments of trustees to health foundations for the terms reviewed by the Community Engagement Committee and the Alberta Health Services Board.
Thank you, Vicki. Will someone second the motion?
Mr. Chair, it's Sherry Fountain. I so second the motion.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Heidi, Chair of the Human Resources Committee, to present the Human Resources Committee report.
Thank you, David. The Human Resources Committee met on September 16th, 2021. The committee received a labor relations update and an Our People Results quarterly report. There were no items that came through the committee for board approval. Thank you.
Thank you, Heidi. I will now ask Saye, Chair of the Quality and Safety Committee, to present the Quality and Safety Committee report.
Thank you, Mr. Chair. The Quality and Safety Committee met on September 16, 2021. The committee received updates on COVID-19 and vaccinations and the Quality, Safety and Access Dashboard for discussion. The committee discussed one item for recommendation of board approval. The committee reviewed the Alberta Health Services Infection Prevention and Control 2020-21 Annual Report to Alberta Health, which provides an overview of the outcomes achieved in partnership with programs across the province. The committee recommended that the board approve the IPC annual report. The board reviewed the IPC annual report and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve the Alberta Health Services Infection Prevention and Control 2020-21 Annual Report to Alberta Health. Upon approval, the AHS Board Chair will then submit the annual report to Alberta Health.
Thank you, Saye. Is there any, may I have a seconder, please?
Mr. Chair, it's Deborah Apps. I'll second that motion.
Thank you, Deborah. Is there any further discussion? Any opposed or abstentions? The motion is carried. Saye, I believe you have a second motion that didn't arise with your committee but pertains to your committee.
Yes, thank you, Mr. Chair. In addition, I've been asked to speak to one motion the board has considered. The board was asked to consider and recommend the appointment of Dr. William Galley as a new external member of the Quality and Safety Committee for a term of 2 years commencing October 1st, 2021. The board is very appreciative of Dr. Galley's willingness to participate on the committee. Accordingly, I move that the Alberta Health Services Board approve the appointment of external member Dr. William Galley to the Quality and Safety Committee for a term of 2 years commencing October 1st, 2021.
Thank you, Saye. Is there a seconder for that motion?
This is Heidi. I will second that.
Thank you, Heidi. Any further discussion? Any abstentions or opposed? Thank you. That motion is carried. As the chair of our governance committee, Sherry pointed out a moment ago, we did not approve the minutes. My apologies for that. I'd like to do that now. There were 2 sets of minutes from July 22nd, 2021 and August 30th, 2021 in the package. May I have someone approve the approval of those minutes?
Mr. Chair, I so move for the approval of the minutes. Sherry
Thank
Fountain.
you. Thank you, Sherry. And may I have a seconder for that motion?
Steve Mandel, I'll second it.
Thank you, Steve. Any further discussion? Opposed? Abstentions? Thank you. That motion is carried. With that, we have reached the end of our agenda. I declare the business meeting adjourned. Thank you for joining us, and please be safe, be well, and be kind.
Together, we do amazing things every day.